Hello friend, welcome to the channel Pharmacy Dictionary. Today we are going to start a new topic under metabolism, and this topic is one of the most important topic for your semester exam point of view, because in semester examination this question has been asked so many times. So what is the topic for today's discussion? That is enzyme induction, their basic introduction and their clinical relevance. So what is the meaning of enzyme induction? First of all, we should understand the meaning of induction, because you know it the very well meaning of enzyme. Induction means to start, to facilitate, to trigger, to stimulate the production of enzyme. So all those agents which are directly or indirectly increasing the amount of enzyme that are responsible for the metabolism of any drug which has been taken by the patient or person is called enzyme inducer, because they are inducing enzyme, and the process of that enzyme inducer is simply termed as an enzyme induction. So first of all, let me clear you the basic importance of this induction. Suppose in general case, normal case, nothing is happening other than the normal one. So someone is having drug, tablet, I mean to say that someone is having tablet and the metabolism is 10%, that should be happen, that is actually a normal process. So that according to the 10% of metabolism, the drug will eliminated from our body. But in somehow, due to some unknown drug or due to some drug taken along with the simultaneously with the drug of choice, the drug metabolism increased up to 20% from the 10%. That means the percentage of metabolism, or we can say the percentage of metabolite which is responsible for the action of pharmacological point of view, it getting increased by 10%. How it is getting increasing from 10% to 20%? Just because of the other drug which you have taken simultaneously along with the main drug. So this drug which is taken along with that main drug is called enzyme inducer, and that is inducing the macrosomal enzyme, and that macrosomal enzyme increasing the rate of metabolism by 10%. So what is going to be happen now? See, in the 10% metabolism, everything was fine, everything was okay, the optimum metabolism is achieved, but now metabolism rate has been increased by 10%. So the metabolism process will be faster, and as well as their destruction, or we can say the conversion into another form, either active or inactive, may be converted. That's depend upon the drug, that depend upon the type of metabolism, whether metabolite will be active or inactive. It's totally depend upon the drug of choice which we have been taken. But enzyme induction, that means only the process of induction will be faster, process of metabolism will be faster, so as their elimination can also be increased. This is called enzyme induction. That means enzyme induction can affect the metabolism of any drug by 2 to 4 times of its initial level. So let me clear you all this point one by one. First of all, the synthesis of the macrosomal enzyme, mainly cytochrome P450, is enhanced by a certain drug and environmental pollutant. So see, where are these enzymes are secreted? There are two types of metabolic enzyme, as we have studied in the phase 1 as well as in the phase 2 metabolism. These are macrosomal enzyme and non-macrosomal enzyme. So these macrosomal enzymes are synthesized by the macrosome of the lining of the liver. This is called macrosomal enzyme, and this macrosomal enzyme are very important, out of which the most important is cytochrome P450. This is another important enzyme which is secreted by the liver cell. So this cytochrome P450 is responsible for the metabolism of almost many of the drug, but due to some known or unknown reason, or due to some circumstances reason, few drugs which are taking along with that particular drug, suppose I have to take drug number 1, but simultaneously, this is the main purpose, simultaneously I am taking another drug, drug number 2. So the drug number 2 will affect the metabolism of drug number 1, or that may also affect its own metabolism. That means drug number 2 can also affect its own metabolism just because of enzyme induction. So that drug which has been taken will increase this cytochrome P450 and enhance the metabolism of particular drug. Not only those drugs, there are some other factors like environmental pollutant like smoking, DDT, pesticide. These all agent can also enhance the rate of metabolism. That is why they have included under the category of enzyme inducer. As like same, we have to study about the enzyme inhibitor in upcoming classes. So this was basic line regarding enzyme induction. Now coming to the next point, this process speed up the metabolism. Which process? Enzyme inducing or enzyme induction process increase the speed of metabolism or biotransformation, because they are increasing the secretion or synthesis of enzyme which is responsible for metabolism. That is why the rate of metabolism is getting increasing. Suppose let me clear with a basic example from our household things. Suppose we have placed some water on the pot over the gas stove and the flame is very dim. So that will take an optimum time. So approximately 1 hour that will be converted into a boiling point in very same flame level. But if I am increasing the level of the flame up to the maximum one or up to the middle one, so that will take lesser time to get boiled as compared to the previous one. So this enzyme inducer are increasing the level or amount or percentage of volume of enzyme that are responsible for the metabolism. That is why they are getting speed up. So this process of metabolism getting speed up just because of inducing drug. And I have explained you that inducing drug can increase the metabolism of first drug, or that can also increase the metabolism of itself, which are totally based on the enzyme which is responsible for the metabolism, and these two are affecting that enzyme. So this is simple explanation. This process speed up the metabolism of the inducing drug itself and other drugs which are metabolized by the drug. So those drugs or those environmental pollutant which are affecting a specific type of enzyme, which are increasing that specific enzyme up to their maximum level, so that enzyme may affect all those drugs which metabolism is depend on that enzyme. This is important one. So coming to the example, this will clear you the process. Examples are phenobarbital, rifampicin, alcohol, smoking, DDT, glycofulvin, carbamazepine and phenytoin are the example of enzyme inducer, and that will increase the enzyme cytochrome P450, and all those drugs which are affected by this cytochrome P450 enzyme will be boosted for their metabolism point of view. Out of this example, the smoking, that is cigarette smoking actually, smoking and DDT are example of environmental pollutant, and the rest of drug of different category like rifampicin is used under the anti-tubercular drug. So glycofulvin can also be used in the different category of drug. So all other drug category can affect the drug of choice or you have taken, can there is boost up their metabolic process. Now there is an important note. This should be remembered. Enzyme induction may be selective for some particular enzyme which are basically caused by DDT. Now let me clear this point first, then I will move further. There are some specific process that's called specification. So here enzyme induction of enzyme by any drug can be selective for specifically few enzyme. That means if I am taking another drug or I am taking intentionally or unintentionally environment pollutant like smoking or DDT, so that DDT, here example is DDT, so that DDT will affect the synthesis of any specific enzyme, not all macrosomal enzyme, only selected few metabolic enzyme. So this process is called specific affection. Now there is also chances that that process of enzyme induction may not be specific, that may be non-selective, that means caused by phenobarbital. That means they can increase the metabolic enzyme synthesis of many types, not only selective, but it may increase the synthesis of many of the enzymes which are responsible for the metabolism of any drug. That means macrosomal enzyme. So next one is enzymes are induced gradually, and they take 1 to 2 hours for their peak action or peak effect. So enzyme induction are gradually. That means if I am taking some drug which is having property as an enzyme inducer, so that drug may induce the enzyme gradually, slowly, progressively. But ultimately their main action of their enzyme induction action can be achieved just only after 1 to 2 hours. That means peak concentration or peak effect as an enzyme induction can be achieved in 1 to 2 hours. So next one is enzyme induction. What will happen if the enzyme is induced by some drug or increased by some drug? So enzyme induction will increase the drug metabolism by 2 to 4 times. As I gave you the example in initial of this video, if the drug is having enzyme induction property, so that may increase the metabolism of the main drug which you have been taken or each other by 2 to 4 times. This is the important parameter. Now I will explain you the process of enzyme induction with a rough diagram or simple flow chart. Suppose this is a drug, general drug taken. I am taking some drug, single drug, and after some time I will take another drug. So I will have 2 drugs at the same time. So in general, what is happening here? Only talking about the one general. In case I am taking only single drug, general drug, the drug will go for the metabolism. Avoid red lines here, only focus on the black one. They will go for the metabolism by the macrosomal enzyme, and they finally convert it into water soluble substance, and so that they may get excreted from our body. This is a normal process. Nothing is going wrong in there. Everything is up to the mark. Everything is as per the process. But now I am taking another drug which is having enzyme induction property, like it may be any of this phenytoin, rifampicin, alcohol, or any other thing. It may be drugs or it may be environmental pollutant like DT. So this drug is now a problematic drug. Now this is going to increase the rate of metabolism by inducing the enzyme. So now we are taking these two drugs simultaneously. So this drug will increase the metabolism of the drug as compared to the previous one. Previously it was taking optimum level, but now it is increasing because this drug and pollutant which you are taking here are increasing its metabolic rate. So this enzyme which are inducing by different types of drug get increased. The volume of enzyme, macrosomal enzyme get increased by this drug, enzyme inducer drug. So now what is going to happen? If the metabolism is increasing, definitely those enzymes are increased. That's why their metabolism increased. So this enzyme increase their increased metabolism. And finally, if the metabolism of the particular drug is increased just because of increase in the enzyme, their excretion will be also faster. So this is called enzyme inducer effect. So there are two chances. I will explain you all the relevance importance of this enzyme induction. Either the drug will get eliminated faster or the drug may get destroyed, and the drug choice is depend upon their specificity, which will clear in the next whiteboard section. So let's move to the next white section so that we may understand the clinical relevance of this enzyme induction. This is one of the most important point I must say, which is responsible for the drug-drug interaction. So if you want to understand the basic concept of drug-drug interaction, then you should focus all these topics like enzyme induction and enzyme inhibition. These two topics is a basics of drug-drug interaction. So let's move to the second whiteboard section. Now in this whiteboard section, we are going to study about the clinical relevance of enzyme induction. Let me explain you the meaning of enzyme induction and enzyme inducer in a very short. Enzyme inducer, all those agents, all those drugs including environmental pollutant which can enhance the synthesis or production of macrosomal enzyme in liver. So thus they will increase the metabolism. These are called enzyme inducer, and the process done by this enzyme inducer is simply termed as an enzyme induction. This enzyme induction as well as this enzyme inducer can affect the need of drug, or that means they can affect the pharmacological effect of any drug, and that can be categorized into two simple ways. Either these are beneficial for the human being or they may not be beneficial, they may harmful for the us. So this is the main classification of enzyme induction or enzyme inducer. I have classified these into main part, or main part are indicated in a red circle. These are drug interaction. So thus enzyme inducer may be converted into enzyme inducer may affect the drug action, and that may term as a drug interaction, or we can say drug-drug interaction. Second point say they may cause tolerance to the drug, and the third point say result in the different types of disease, as well as next one is response variable, and at the last their significance value, their important advantage can be seen as the therapeutic application. These are main point under the enzyme induction, but there are few sub point regarding drug interaction. So let's start this drug interaction first. What is the meaning of drug interaction? See, we have to split this word into meaningful sentence. The first one is drug. You know the meaning of drug. And the second one is interaction. This interaction is made up of two simple words. Interaction. That means whenever we take more than two drugs, they will interact with each other. They will try to compete with each other in somehow. So one drug may affect the action of the other, or second drug can affect the alter the effect of first drug. So there is sequence. There is a chances of alteration of response of each two drugs. This is called drug interaction. So this is applicable only where we will take two or more than two drugs. One drug is for their therapeutic value, and the second one may be a therapeutic value or their supplement. Like in case of different therapeutic value, we used to give antacid, anti-secretory drug, so that counter the production of acidity. So in that case, main drug is something else, antibiotic, but this antacid is supportory drug. So this can be happen with any kind of drug combination. Drug interaction may result into severe problem because that may convert into adverse effect, and sometimes that can also cause the fatal effect too. So what are the consequences under this drug interaction are summarized as a sub point. The first point say therapeutic failure. What is the meaning of therapeutic failure? See, so first of all we should know the meaning of therapeutic use. Therapeutic use, that means any use intentionally which has been taken just because of the drug, so that we can get cure from that particular problem. That means simply desirable effect from any drug is called therapeutic importance. But what is the meaning of therapeutic failure now? The failure of the drug to produce its desirable effect is called therapeutic failure, and that is a drug value. So why the therapeutic value is going to be failed? Just because of enzyme induction or just because of the enzyme inducer. How it is possible? I have explained this in a simple equation form so that you do not need to worry about the lengthy theories. These are, see, first of all, increase in the enzyme production just because of enzyme inducer. So if the enzyme production is increased, they will increase the process of metabolism. If the process of metabolism increase, their excretion may also be increased, or in how between if the metabolism is increased, their intermediate metabolite may also be increased, and somehow their excretion will also be increased, and that may affect their duration of action. If the elimination or if the excretion of drug is fasting up just because of enzyme inducer and intermediate metabolism are also increasing just because of enzyme inducer, then there is definite chance of inhibition of the duration of action. What is the meaning of duration of action? Suppose I have taken any drug at 12 p.m. and I am expected its effect up to 2 p.m. just because of its normal actual profile. But now just because of enzyme induction or enzyme inducer, the effect of the drug will not be longer up to 2 p.m. That may be less than 2 p.m. or anything else, but that will not be exceed or up to the 2 p.m. So that is the enzyme inducer effect, as they will increase, as they will inhibit the duration of action. If the duration of action of drug will be reduced, inhibited, so how can we obtain sufficient significant pharmacological effect? So at last, what will be the result? The result will be into a non-sufficient therapeutic effect, or we can also say therapeutic failure of the drug just because of enzyme induction or enzyme inducer. Now second one, now let's take example here. Over this example says failure of oral contraceptive with rifampicin. This is one of the most important drug-drug interaction, or we can say example under the influence of enzyme inducer. This has been asked in a many examination. So if some woman is taking oral contraceptive pills to avoid the pregnancy, and if she is also having the tuberculosis problem, then she is also taking rifampicin. But if those two drugs are taken simultaneously, the effect of oral contraceptive will be nullified or will be cancelled just because of the rifampicin, because rifampicin is inducing the metabolism of the particular oral contraceptive drug, and the duration of action or the effect or pharmacological effect of oral contraceptive will not be longerly available. So this is important example to understand the drug-drug interaction. Now coming to the second part, second subtype or second explanation regarding drug interaction, this is toxicity. What is the meaning of toxicity? Anything which is a part of your body or which is not a part of your body, but that may convert the normal physiological response into unwanted condition, and that condition is so severe that it may convert into toxic response, and finally the patient or person may die. This is called toxicity. The strength of toxicity depends upon the metabolite produced by the different drug after the metabolism. So it's a dose dependent manner actually. So what is happening in case of enzyme induction, in case of drug interaction, in case of toxicity? See, enzyme induction. If some drug is inducing enzyme, so ultimately the process has been completed and termed as an enzyme induction. If the enzyme induction is taking place, there will be increase in the production of toxic intermediate. What is the meaning of toxic intermediate? I have explained you regarding this metabolite in phase 1, phase 2 reaction. Intermediate means a product in between the furnishing. That means it is a starting product, this is the ending product, and whatever product is formed just between these two, starting and ending, is called intermediate product. So this is called intermediate product, and this metabolism which has been increased or enhanced by enzyme inducer can cause production of intermediate toxic material. Example, rifampicin will cause hepatotoxicity when it is taken with the paracetamol. See, rifampicin is also available in the first example. If someone is having rifampicin, obviously for treatment of tuberculosis, and if person is chronically taking paracetamol for general purpose, for painkiller purpose, for antipyretic effect, or other use of NSAID. So these two drug combination, rifampicin, that is anti-tubercular drug, along with the paracetamol, which is example of NSAID, antipyretic drug. So these drugs convert into toxicity, and this paracetamol convert the toxicity of into hepatotoxicity. That means problem in the liver. malfunction of liver or any associated problem related to the liver or metabolic side. This is just because of the interaction between rifampicin and paracetamol. Now coming to the second relevance, clinical relevance of enzyme induction, that is tolerance to the drug. What is the meaning of tolerance? See, we have studied about the tolerance in the previous video. Tolerance is a process or phenomena in which our body does not respond to the drug dose which has been increasingly orderly. That means if I am taking 500 mg of paracetamol continuously in a less frequent interval, so at the time where paracetamol 500 will not be produce a same effect as it used to produce in a earlier time. So I will need to increase the dose of particular drug. That is called tolerance, because my body is not responding to that particular dose of the drug, not for the drug itself but for the dose of that particular drug. This is called tolerance. If the metabolism is getting increasing, so you are not going to obtain the specific duration of action of the drug, so you need to take complete repeatedly drug, so that may convert into tolerance of the drug. So let me explain with example. Example says carbamazepine, it induce its own metabolism. Whenever we are taking carbamazepine, that will induce they can induce or induct the enzyme, macrosomal enzyme, and that enzyme itself to the carbamazepine increase its metabolism. As I have explained you, the metabolism can be increased by the inducer, and that inducing effect can also be applied or applicable to the inducer drug also. So here it is carbamazepine will induce its own metabolism, and the phenomena where drug induce its own metabolism is termed as a auto-induction. This is important terminology. You should remember this word because I have highlighted it into a red color. Now coming to the next one, that is result in a disease. Something happen, and that something happening process can be altered by any other drug, so that process convert into a disease formation or result into a disease. How it is possible? Let me explain you. Anti-epileptics enhance breakdown of vitamin D. If someone is taking anti-epileptic drug just to relieve from the epileptic condition, so this anti-epileptic drug or chances or having possibility to enhance the breakdown, this will break down the vitamin D, and you know it very well, the vitamin D is very important for us. So this will convert into deficiency. Now what will happen after the destruction or breakdown of vitamin D? Now this result into osteomalacia on prolonged use, because there is a deficiency, or we can say continuous deficiency or chronic deficiency of vitamin D just because of anti-epileptic drug. So now the problem is going to happen along with the mal-availability or less availability of vitamin D, and that is called osteomalacia. Now coming to the next one, that is response variable. That means variable in the response. Some time ago, if there is no enzyme induction, the response of the drug may be something else, but just after taking some enzyme inducer, the response of the same drug or same dose, same patient may not be same. That is called variable in the response. So see, in chronic smoker, a person who is smoking continuously, chain smoker we must say, so in case of chronic smoker and alcoholics, the enzyme induction may result into failure of expected effect. Someone is not having alcohol, someone is not smoking continuously, so that drug may affect something else on the non-smoker, non-drinker, but the same drug may affect in a different way with the smoker and chronic drinker. So this is an example of enzyme induction, variable based by the different factors, because smoking and drinking can be converted into or included under the environmental factor of enzyme inducer. So this is an example. Now at the last we have to see their importance. These all points are unwanted effect, but now there is an important advantage of this enzyme inducers also. This is therapeutic application. Neonates are deficient in the macrosomal enzyme, so that inability of macrosomal enzyme convert into a jaundice, and that jaundice can be treated with the help of enzyme inducer. This is important question which has been asked in the main examination. What is the meaning of that? Neonate is having lack amount of this macrosomal enzyme. So if they do not producing much amount of macrosomal enzyme, how the conjugation reaction will be take place, how the bilirubin will attach to the group. So this is converted into a deficiency of macrosomal enzyme, and that may result into a jaundice. And now how can we treat that? If we are induce the metabolic response, if we give the inducer of enzyme, they will increase the production of macrosomal enzyme, they will conjugate with the bile, and that will get eliminated or excreted from our body. So there will be a reduction in the yellowish color, that is called jaundice. So this drug phenobarbital and other enzyme inducer, specifically drugs for the neonate, can help them to come out from this problem. So this is a very important example of use of the enzyme inducer or the process of enzyme induction. So this topic we have studied about the enzyme inducing effect, that is enzyme induction or enzyme inducer, their relevance, clinical significance, along with their advantage and disadvantage. So that's all for the day, and the reference for today's topic is Padmaja Uday Kumar and KT Tripathi. So if you do not have any of this book, no need to worry about. After some time you will have the screenshot of this whiteboard section. So again, thank you very much. Please do take care of yourself, and please don't forget to give us our feedback, because we are not fluent in English. Our mother language is not English, but we are trying our best so that we may deliver the concept directly to your mind. Thank you again. Take care.